Hi, and welcome to Pearls, Procedural Education for Adaptation to Resource-Limited Settings. We can all be quite comfortable when we have the medical supplies we're used to, but take those away from us when working in a resource-limited setting and providing care can be challenging. That's why we developed Pearls, an online video series which showcases low-cost modifications to common procedures for use in resource-limited settings. In this video, we'll describe how to make simple, earplug-adapted, low-cost, or seal bubble CPAP nasal prongs, as described by the authors of this paper in the journal Pediatrics and International Child Health. As you may recall, bubble CPAP uses a simple design relying on oxygen being channeled through various depths of water in a bottle, with the depth of water in centimeters corresponding to PEEP. We describe how to make the modified bubble CPAP in additional Pearls videos. While we discuss indications for bubble CPAP on the Pearls videos teaching how to make the circuit, the indications for using the seal nasal prong modifications are for children from 1 month to 5 years of age with respiratory distress who are on bubble CPAP and have an air leak around one or both of the nasal prongs. Contraindications for using the seal prongs are pneumothorax, as a better seal increases the risk of expanding the pneumo, nasal trauma including active nose bleeding, and a GCS less than 4 due to the inability to protect the airway with added aspiration risk. Accordingly, when using this modification, you'll want to watch for pneumothorax and can minimize this risk by avoiding pressures greater than 10 centimeters of water, nasal tissue breakdown, and you should reposition the prongs if you start to see erythema, and aspiration and vomiting. You may need to add an NG tube for decompression. Supplies needed for this modification include a nasal cannula, pointed tip scissors, super glue, and soft compressible earplugs. The first step is to cut the earplug into 1 centimeter cylinders. Next, poke a hole with the tip of the scissors or a needle directly in the middle of each coin-shaped earplug piece. Next, stretch each earplug over the nasal prong, allowing a slight portion of the prong to protrude, and secure each plug with a drop or two of superglue. Once the glue is dry and the earplugs are secure, they can be squeezed to allow for insertion into the nares, and when they re-expand, they will provide a better seal. For smaller children and young infants where the compressed plug is still too large for the nair, you can cut a smaller version of the plug that allows more of the prong to protrude. In this scenario, the entire plug stays outside of the nair and decreases leak by pressing up against the nose rather than expanding from within. Be sure to check out these and other videos, including live demonstration videos, available at sugarprep.org/pearls. And finally, don't forget to check out the full text references provided throughout this video.